In early 2018, the Ugandan government signed the Memorandum of Understanding with the Cuban government to bring into the country over 200 Cuban specialist doctors. According to the Health Ministry, the foreigners will be deployed in regional referral hospitals across the country where there is acute shortage of specialists. Minister of State for Health in charge of general duties Sarah Pendi has been quoted saying the Ugandan specialists shun working in rural areas. Now the Uganda Medical Association, the umbrella body of doctors in the country, says unless government makes drastic changes, the Cuban doctors would face the same poor working conditions the Ugandan doctors have been grappling with.
The reasons that specialists are not available in the rural hospitals, in the regional hospitals, and in the public sector are what motivated the doctors' strike, which we didn't end, by the way. We are waiting for the General Assembly. I just need to clarify that.
The association also urges government to first meet the demands they made during their recent industrial action. Government reportedly mooted the idea of bringing the Cuban doctors during that strike. The Medical Association appreciates the global standard of free movement of medical workers and so pledged not to frustrate the government plans, provided their interests are met.
We here in Uganda should start to be prepared to enter into contracts, agreements with foreign countries to share health workers.
The Medical Association chairman, Dr. Ekwaro Obuku, also urges government to pay the Cuban doctors the same salaries Ugandans with similar qualifications and expertise are paid. Government reportedly plans to pay the Cuban specialists 5.4 million shillings, at least 1 million shillings more than the 4.5 million shillings the local senior consultants are paid monthly.
That physicians who migrate should be paid the same, and this is very important, isn't it? They should be paid the same as domestic physicians at the same level or rank, okay? They should receive this as their income and should not vanish into the hands of another government, which then returns pocket money or non-convertible currency. This is what we do.
The Uganda Medical Association also demands the vetting of the qualifications of the Cuban doctors to avoid the importation of quack doctors.
We actually have something called the MLE, the Medical Licensing Examination Board exam, which of course, if government decides that the Cuban solution is the way to go, we will, as Uganda Medical Association, be interested to review those results.
Dr. Ekwaro also wondered how the Cubans, who mostly speak Spanish, would communicate with the rural Ugandans, many of whom cannot speak English. He fears that the patients may end up receiving wrong medication.
Not only communicating to the patient, but also issuing instruction. For example, the doctor to the nurse and vice versa. And it impacts on quality of care for the patient because miscommunication can lead to medication errors.
Official records show that as of July 2017, the government had 1,477 doctors on its payroll. But the annual health sector performance report for the 2015-2016 financial year indicates that there are 1,109 vacant positions for medical doctors, with field staff levels standing at 49% across hospitals. Habad Ziwa, NTV.